1,000 doctors plan to quit the NHS because they're disillusioned with the government's handling of the COVID-19 pandemic and frustrated about their pay. This is a new survey. It's by the Doctors Association UK. One of the accusations and one of the things that seems to have been turned up by the research is that the government fails to value doctors. This is from Samantha Batt-Rawdon, the president of Doctors Association UK. Does the government fail to value doctors? Dr. Jenny Vaughan, health policy lead at the Doctors Association UK. Good morning to you.
Hello.
We value you.
Yes, well, you might, Andrew, but the problem with this survey is that doctors are not feeling valued by the NHS. And might I say that just because the Doctors Association, obviously we lobby on behalf of doctors, but we also work with nurses, and I have absolutely no doubt that nurses feel exactly the same way. They've come out, as we say, burnt and battered from this pandemic, and, you know, there's no doubt that we may face another second wave going into the winter. And yet the government has reneged on so many things, and they don't feel valued. They've been putting their lives on the line, and all the promises have been repealed. You know, it's about value. This is, and it's shocking. It's shocking that we could be losing all of these highly qualified people who put their lives on the line because of the government's mishandling of this crisis. Yeah,
I understand where you're coming from. You can speak to any GP anytime, socially, professionally, and they're going to, and you're going to hear the same thing. And I do understand that. When it was examined in this research, what will GPs do if they sort of move on and change their position? Some said move abroad. Some said take a career break. Some said switch to private hospitals. Some said work as locums. I have to put it to you, there's an awful lot of people during COVID who don't have a job at all. Whole industries have been decimated. Employers are reducing salaries, and the next round is going to be even more cuts when furlough comes to an end. So it's a little bit whiny at the moment from GPs who are generally pretty well paid compared to others. You know, there's an awful lot of people who don't have a job at all.
But, you know, I totally, you know, this whole, nobody's pretending that this whole pandemic hasn't been devastating. And can I just with respect to the survey, obviously you've honed in on GPs, but can I point out half the people who replied were junior doctors, and they're not in the same position. Right. And many GPs are salaried GPs. You know, we are not. It's about value. Andrew, you remember when we were all, you know, government ministers were on the streets, they were filming themselves, we had selfies of them clapping. We had Boris clapping in front of Downing Street. If you're going to clap for us, you need to value us. MPs have had a pay rise. You know, this isn't just about pay. Remember, we've lost over 540 healthcare workers in this country to this virus. This is about our lives. It's about the lack of the government response early on and ongoing to personal protective equipment. People were going into work. They were looking after their colleagues on ventilators. This is about value, and the fact that, you know, the pay rises that have been put in by the government were actually, a lot of them were agreed before, but the main ones have actually ignored junior doctors on the front line, ignored nurses, ignored paramedics. There are vast groups, and it isn't just about pay, because I do take your point about what's happened to many workers in this country, but this is about valuing the very workers that we depend on, you know, to sort us out and get us better from this virus.
I get all that.
When they go into work, they're putting their lives on the line.
I'm duty bound though, and I want to scrap with you just a little bit. The OECD suggests most British GPs earn more than 100,000 plus pension a year. NHS. Hold on 1 second. One second. Sorry, Jenny.
The junior doctors here.
Yeah, I know. I just said most British GPs. NHS Digital say that self-employed GPs across Britain are paid an average of 109 grand in 2017-18. So there's some pretty good pay about, is a point that I would make.
You're focusing very much on partners' pay. And you know, that kind of thing. You're not focusing on salaried GPs and junior doctors. And they were the vast majority of people that filled out our survey. And I don't want to get distracted on that, when actually the people that filled this out are the people that everyone is going to depend on to get them through the second wave, to come in and do the job and look after them and put their lives on the line.
Okay.
I don't think we should be focusing on a small number of GPs, most of which won't have filled on our survey. We've had a third of GPs, many of them are salaried. They don't earn the amounts that you're saying.
What sort of a pension pot have you got after 20 years, Jenny? I'm sorry to challenge you. I know you've made those points, Jenny, but let me ask you, after 20 years, what is your pension pot going to be worth, and what will your salary likely be if you're a doctor? Yeah,
the vast majority of people that filled in this survey are not earning the numbers that you're saying.
Okay,
they're going to be expected to look after the population when they come in and they need to be cured of COVID and looked after and put their lives on the line.
So what do you want,
Andrew,
then?
How much would you be paid to put your life on the line? How much would you be paid? How much would you that responsibility, what would you be expected to be paid for that? Your family's life, your mental health. When you go into work, are you going to be looking after your colleagues on ventilators? What level of pay and value
I'm not.
is that about?
I'm just trying to put to you that you knew what you were. A lot of doctors knew what they were signing up for, and that things happen which are not easy. And this has been brutal, and I'm not denying that for a second. And I was, I was out there the same as you, clap, 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 all the rest. But I'm just saying that the upside is that a lot of doctors are paid very well. And not everybody is on the front line, are they?
I think and a lot of those frontliners, and including junior doctors and also salary GPs, are not paid so well, and they have been missed out of pay deal. But this is actually not mainly about pay, although, many of them cited pay because pay was about value. This was about going in an unprecedented time, and I'm sorry, Andrew, most people didn't expect to potentially lose their lives when they signed on the line and became doctors. No. They go into work, and despite knowing that, they are still saying, we're here to look after you, we are going to be there for you. And if we're prepared to clap them, then we should be prepared to value them.
I started this by saying that you are valued. I've got to leave it. We're way over. Jenny, we've talked enough. And I really think that you've made some strong points there. Thank you very much for your time this morning, Dr. Jenny Vaughan.
The bottom line is the government needs to value the people that look after the people of this country.
Right. Dr. Jenny Vaughan, Health Policy Lead at the Doctors Association UK. 7:49, Holly Harris.